Hello, I'm Danielle Louder with the Northeast Telehealth Resource Center, and I'm happy to be part of this Rural Telementoring Training Center Toolkit and app launch. Today, I'm going to be talking with you about the intersection of digital equity and rural health, specifically with respect to key considerations for telehealth. Just a little bit about the Northeast Telehealth Resource Center, or NETRIC, as you'll hear me call it throughout this presentation. We are situated within MCD Global Health, which is a nonprofit public health organization, which has been doing work to improve the health and well-being of people across the globe since 1966. We are based out of Maine, and we partner very closely with folks at the University of Vermont and with our colleagues at the National Consortium of Telehealth Resource Centers. Just a couple of disclosures and acknowledgements. Any information provided here today is for educational use only and should not be regarded as legal advice. And I do not have any financial interests, arrangements, affiliations, etc., with organizations related to telehealth technology or services. Just many thanks, as always, to our funders at HRSA and the Office for the Advancement of Telehealth. And with that, just a little bit about our partners. As mentioned, we are part of the Consortium of Telehealth Resource Centers. And while we cover the Northeast, the 6 New England states, and New York, collectively, our colleagues within the consortium cover all 50 states, DC, the Pacific Basin, the U.S. Virgin Islands, Puerto Rico, and we also have 2 national TRC partners. One is the Center for Connected Health Policy, which covers all things telehealth policy landscape, which is, as we know, over the past couple of years has been constantly shifting. And then the Telehealth Technology Assessment Center, which covers all things in the ever-changing landscape of telehealth technology and digital health. So I think more so than telling you about all of the different services that we provide, which are many, I'd just like to say that we're really here to provide training and technical assistance that meets folks where they're at. So if you haven't connected with your telehealth resource center, please do. We cover everything from telehealth training and technical assistance to program development to business strategy, including reimbursement and well above and beyond that. So please connect with your telehealth resource center if you haven't for that training and technical assistance. This is just a list of some of the many things that we do. Again, we're really about meeting folks where they're at. If you don't see your need listed here on this bullet point list, please still reach out. If we don't have something, chances are one of our colleagues at the other telehealth resource centers or partners across the country have it. So we want to help you prevent recreating any wheels when it comes to implementing or evaluating your telehealth program. So please reach out, and we're happy to help. The telehealth resource centers really do focus on the cadre of the different types of telehealth technology, from video conferencing like we're doing here today, store and forward or asynchronous uses, remote patient monitoring, mobile health applications, which have been sort of become quite ubiquitous, used across the country and across the globe to manage our health and wellness. And then peer-to-peer use cases such as e-consultations, Project Echo, et cetera. So and we're really seeing folks focusing more on digital health strategy and how can we use all of the different types of technology across a wide variety of use cases, medical, mental health disciplines, et cetera, which has really been great to see over the past few years. So there are clearly value perspectives for utilization of telehealth technology to address key needs, particularly with respect to reaching rural and underserved populations, which is what we really want to focus on here today. Accessibility for consumers and patients. It's really about getting the care when and where they need it, right? Affordability, it reduces the time, to travel, expense, and time away from work and family. Timeliness, it reduces the wait time to access specialists, which can make not only life-saving, but quality of life differences for folks who may have otherwise had to wait or not get those services at all for a particular diagnosis or prevention of exacerbation of a chronic illness, et cetera. And really integrates that team approach to care. And you can see across this slide that it impacts communities. It keeps patients local where they want to be. It keeps that healthcare revenue there. It really improves the population and productivity of the community as a whole. Primary care providers, specialists are also realizing positive impacts with reduced no-show rates, promotes coordinated care, maintains that relationship with both types of providers, promotes greater patient satisfaction, provider satisfaction as well. We know the workforce shortage issue is absolutely critical right now. So anytime that we can use our tools, including telehealth technology, to help address that and get patients seen earlier and more effectively is just a huge benefit. And then from a health systems and health plans perspective, really promoting that timely access to care, decrease exacerbation of disease, reduce hospitalizations. Models like electronic consultations or e-consults have shown great impact with respect to reduced hospitalization, reduce unnecessary tests and things like that. So better management of patients with multiple chronic conditions, improving population overall population health overall, and then really those cost savings that are benefiting everybody across the board. So how do we plan for early success and wins? And this is really true across anything, not just telehealth, but really looking for those low effort, high impact. So this graphic just shows, where's that low hanging fruit? Where can we really utilize telehealth technology, digital health strategies to impact something within our own healthcare organization or within the health system that has really been a challenge. Access to care for rural populations, for example. So here we go, kind of thinking through that planning for success and failures. It's okay to fail. And again, whether it's technology or anything else, it's quickly adapting, recognizing that there may have been a challenge, adapt, try again, adapt, try again until it works exactly as you would like it to. So some high-level pearls. What is the problem that you're solving for? Whether it's access, whether it's wait times, which is directly, related to access, et cetera. What are the key pain points that you're seeing within your organization, your practice, et cetera? And could telehealth technology be utilized to help address it? Be realistic. Make sure that your goals are practical and expect things, monkey wrenches, changes to be happening. We certainly have seen with the COVID pandemic that change has become the expectation, right? So expect that and adapt. Clearly define success and how you'll measure your progress. Make sure that you align your incentives to drive adoption. How are you going to get buy-in from all of the different players in order to help them and make sure that it's user-friendly, which goes to engaging all end users. That includes patients, consumers, families, clinicians. Everybody has to be part of the discussion. And from the start, don't select, technology with a lot of bells and whistles, but doesn't work or it's overly complex and nobody wants to use it. Identify your information technology or IT requirements. Plan for implementation, including training, practicing, and stuff breaking. I can't stress enough that it's really more about the people versus the technology, right? People have to feel confident and comfortable using this technology. So spend time on your best assets, which are your people, and make sure that they're well trained. Be nimble and revisit your plan as needed. Things change, right? Especially technology has been changing very quickly over the past few years. Communicate often and be transparent. If something goes wrong, fix it and adjust and test and fix it again if you need to and keep moving forward. And again, just don't give up, learn from those challenges and keep moving forward. And then, selecting that technology solution, you want to shop informed, right? So ask the key questions. And that's a great thing that the Telehealth Resource Center can help you out with. What questions do I need to ask my telehealth vendor, solution to vendor, whether it's like actual technology, devices, software solutions, or a telehealth provider vendor? What are the key questions that we need to ask to make sure that this solution really fits the needs of our patients, our providers, et cetera? What are the long-term considerations around cost, maintenance, et cetera? Engage your clinical leads and IT team. It's really that three-legged stool, right? It's technology, it's clinical, and it's administrative. You have to have that administrative support behind it as well. Know what you want and look for it. So what are the essentials versus nice to have? And we're going to talk about digital equity and accessibility here today. And I'm happy to say that while those things may not have been pre-COVID, they may not have been, top of mind. And when folks were planning their telehealth initiatives, programs, but we really have seen a shift in that over the past 2 to 3 years. Versus those nice to have bells and whistles, right? Sometimes they're not practical, and sometimes they're they make things more complex than they need to be. Know your boundaries, communicate often and early, and set expectations for customer service, for example, on the technology solution that you've purchased. What does success look like? What impact are you looking to make, and for which populations? Have you increased access? Have you decreased wait times? Have you improved patient satisfaction? Which particular populations are best suited for telehealth? And again, telehealth is not the right answer for all use cases, and it's not the right answer for all individuals. So it's really got to be patient-centric, just like your in-person care. If somebody does not want to use telehealth for any given reason, it's off the table. Maybe reintroduce it later on, but for whatever reason, at that point in time, they're not interested, whether it's, concerns about confidentiality, maybe they don't have access to the internet at home. There could be multiple reasons. Try to dig into that a little bit, but don't push it. What outcomes will indicate that you've achieved your goals? Again, have you seen decreased wait times for specific specialty services within your primary care practice, for example? Have you seen reduced hospitalizations among your CHF patients if you're doing remote patient monitoring? Again, choosing those measurable goals and making sure that you're hitting them. And if not, why? What might be some of the issues? Is it workflow? Is it patients aren't interested in using it? Providers giving pushback, et cetera? Again, make sure those goals are reasonable, realistic, and then look to knock them out of the park. And then look at your data, right? So how will you capture it? How you'll know it's working? You can do surveys, you can look at your claims, you can look at medical records. What are your numbers of visits, activities accomplished at the beginning when you're setting up your program? How do you know you're successful in doing that? Performance data, how well did you accomplish? What are your patient and provider satisfaction surveys looking like? What impact did you make? And then making sure you're looking at the human side of things. Case studies can be extremely effective, and people love to tell their stories and how they were impacted, whether it be access or a diagnosis that may not have happened, et cetera. So Tele-Tech things to consider. Provider and patient video etiquette. I think we've heard a lot about this over the past almost 3 years now with COVID, but really, making sure that your camera is in the right spot so that you're not to one side or the other. Make sure the microphone quality is such, particularly from an accessibility perspective, that people can hear you well. Identification, verification protocols. We have some providers who the first time, they visit with somebody, they actually show their license or their name tag, their ID, their official ID, to show and create that trust, right? And speed of speech. I have to talk to myself about this quite often because I tend to speak very quickly. And so I was slowing myself down. And then muting yourself when typing. Be transparent that I'm going to be taking notes over here, like I would, during an in-person visit, so that I can capture everything from our visit. So that if you are, looking to the side, that the patient understands that's why you're doing that, but muting that so that there's not, that distraction in the background. Room design, look at your lighting, make sure that you don't look like a ghost or an alien with some different lighting. Lighting changes throughout the day, so consider that as well. Background considerations, even clothing. I actually changed my sweater today because on this lighter background, it was washing out and it was difficult to see me. So just think through things like that. Looking at maybe you have a specific room dedicated to telehealth visits so that you're not constantly having to think about changing things up. Or if it's the right setting, maybe you do have transportable technology like a tablet, et cetera, if that's the most effective way to make sure that you're ensuring access to everybody that you need to see. Always consider having wired internet if you possibly can versus Wi-Fi, because it's just more reliable. Sometimes that's not going to be possible, and that's okay, but make sure that you do have adequate Wi-Fi to make sure that your visit is not going to be interrupted by poor connectivity, etc. And then just thinking about integration with your electronic health record or dental record if you're a dental provider watching today. So important steps pre-telepractice. Think about doing site visits, right? Whether this is you, a provider, your technology team, et cetera. If it's not, a space that you're familiar with. So, what is the room like? Of course, we're not going to go to individual patient homes, although if you're a home health provider, you very well may do this. And you can do some of these things virtually as well, but considering what the room is like, where is it located? Is it private? A skilled nursing facility is a great example of, making sure that the room is appropriate for doing these visits. How are the lighting, the acoustics? How close is it or far away from key personnel who might need to assist during the visit? Safety issues, who's available for emergencies? How quickly can they be summoned? And then always thinking about the documentation, right? The paperwork, licensure. We know during COVID, there were many flexibilities in policy, but essentially, to provide telehealth services, a provider needs to be licensed in the state where the patient is located. Thinking through credentialing and site privileges, and then thinking through any specific state prescription monitoring programs and of the like. So emerging, I call these emerging because we have definitely seen a shift in these things are much more top of mind since COVID happened, and we had a tsunami of telehealth visits happening overnight. So they really, again, it's been great to see that they're higher priority among folks who are doing telehealth. So you can see there are considerations across the board for patients, providers, and then both. And so really, when thinking through the needs of both, that ease of use, access to technology, access to adequate and affordable internet, I would say, continuity of care, making sure that if, services are provided via telehealth, that, if you're the specialist, you're reaching back out to the primary care provider and sharing that information back, et cetera. And then privacy and security concerns. And then, we've been talking about, and we'll talk more about some of these patient and provider key considerations. So thinking through for patients, again, do they have adequate equipment? Do they have a smartphone, a laptop, a tablet that will enable them to see and hear you? Is their internet reliable? Are they concerned about their data plan and the cost of that and running out of data and not having any left for family, friends, et cetera? That's that common concern. How familiar are they with telemedicine, and do they have concerns with trust or confidentiality that really should be talked about ahead of time so you can help them through that? Are there any language barriers, and do they need adaptive devices and or software solutions? Again, we've seen some nice adaptations with respect to having translation services embedded within the software solutions, transcription services embedded within. So this is even, for the designers of technology and telehealth solutions, it's much more top of mind. Special considerations for video, thinking through privacy, security. If you're a provider, showing who's in the room with you, again, to build that trust and transparency. If you have a colleague in the room, or if you have another provider who could or should be part of the visit because it's a multidisciplinary visit, et cetera. Ensuring the privacy of the client, and clients don't, or patients don't always feel comfortable or safe divulging that information. So ensure that they're able to speak freely and be on the camera without others in the home hearing. And there's some links here that you'll have access to when you get a copy of this presentation that you can check out for some more detail there. And then what do we think about before scheduling visits? So inclusion and exclusion criteria from the patient perspective, really thinking about digital literacy. And it doesn't mean that we have to exclude those patients, but it means that we have to spend some time ensuring that they are confident and comfortable with using the technology ahead of time. And we might need to help them find some training for that. And there are many different options for that, depending on your state, et cetera. Again, I would encourage you to reach out to your Telehealth Resource Center if you're not sure where to find some of those. Do they have access to the devices they need? How about their broadband or their Wi-Fi connectivity? Is it adequate? And then patient preference. Encourage adding a question about preference on the patient registration form, which can help you learn a lot in a short period of time as to whether patients are interested and or excited about using telehealth for their healthcare. And then from the clinic angle, is it medically appropriate? And that's really what telehealth comes down to, right? Like you should be able to provide care at the same standard as you would be in person, right? And so it's really left to the clinician to determine that. There are some use cases that are very clearly not appropriate for telehealth. While there are many, 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 and especially during COVID, we saw a lot of creative solutions to ensuring that you could meet the standard of care by using, different tools in the toolbox. Is it covered? Is it reimbursed, and by which providers, right? And again, if one state's policy for telehealth coverage, one state's policy. So reach out to your Telehealth Resource Center. That's what we're there for, to help you get into the weeds with that. Compliance, licensure, regulatory, provider education. Again, invest in your people and make sure they're feeling really comfortable and confident with using the tech. Pre-visit considerations, help people know what to understand, right? This is actually a link to a video that our colleagues at the Pacific Basin Telehealth Resource Center made. It's wonderful. And it really, in just a few short minutes, helps patients, consumers understand, so what is this telehealth thing, and what should I expect? How can I be ready for it, et cetera. Tips for starting a visit: make sure someone on your care team, and it can be multiple different people, but make sure they understand their role and which parts they're playing, so you're not having duplication of effort, because nobody has time for that, right? Make sure that, a brief technology check is done to make sure they can see and hear, reviewing the provider's name and credentials. Again, there's that trust building. Confirm the patient is in a private, comfortable location. Confirm if there's anybody else in the room, and if so, is that okay? If not, maybe you need to end the visit and reschedule. Confirm, the patient's identity. And again, it could be something as simple as, them showing their license or another document. Reviewing the purpose of the visit and confirming their consent to be treated via telehealth. Confirming their current location. Now, this is really important from an emergency and or crisis perspective, right? So that if you did need to send help, that you could do that quickly and know exactly where they're located. confirming their patient backup contact information, emergency contact, reviewing emergency procedures in the event of a technology failure or other event, tech troubleshooting, and then reiterating the privacy and security of the visit and the software. So this is just one example. There are so many others out there, but because, we have this information, just wanted to kind of share it as an example. So AYA, or adolescent and youth experience for telehealth services, benefits that we've seen in the literature, patient comfort, and this could be said across many different types of populations, not just adolescents and youth, but it's that place of solace, right? Versus going to a strange place that you're, not necessarily familiar or comfortable in. Eliminating travel, which can be particularly important for rural, for youth, for older adults who may not have a vehicle or funds to get to a visit, an office visit in person. Flexibility with schedules, with life in general, independence, and especially, with teens and young adults, they can have that important one-on-one time with a clinician in a quiet space, either at home or school, where we have been doing a ton of work with telebehavioral health programs within schools. And if folks are interested in learning more about that, please reach out. But we're seeing some fantastic outcomes in helping combat the youth mental and behavioral health crisis that we're seeing in this country. Some barriers, ensuring privacy, right? Really, setting that expectation right from the very beginning, and making sure that whoever your patient is, regardless of their age, understand this is like an in-person visit, in that, there are certain expectations with respect to privacy. We're not going, to go to a coffee shop and do this visit, et cetera. And then technology, virtual care requires technology such as high-speed, reliable internet, smart devices, laptops, software, et cetera. And that can be a barrier for many. So just making sure that you're aware of these things ahead of time. Screening considerations, just who is presenting the screen, how and when is it presented, make sure that confidentiality is understood, and that there's comfort there. Privacy during the administration of the screening, and these could be depression screenings, age-specific screenings, et cetera. Assistance with completion if needed, attitudes towards screening, scoring processes, sharing results, and follow-up. Screenings can be done very effectively via telehealth, but you're just needing to make sure that you're considering all of these different aspects and how they are different than if they were to be done in person, and adjusting for that. And there's some great clinical guidance. Again, this is an adolescent youth example, but similarly, you can find some great guidance out there with respect to how to do this effectively via tele. So consent and confidentiality, and again, we have our adolescent example here, but this really could be extrapolated to different populations. Ensuring they know their rights to confidentiality and consent is central to providing patient-centered care. The patients are more likely to openly discuss their health when they're aware of what information can and can't be shared. Many confidential services can be addressed in a virtual visit, such as contraception, testing, and treatment for STIs, substance use treatment, et cetera. And we have definitely heard that it's often a case where this age group feels more comfortable providing that information via tele versus in person. And so there's really more solid information to develop a treatment plan for folks. If you're just doing a risk screening face-to-face with the adolescent, realize that it may be more difficult for them to answer directly to you than filling out the screening tool on their own time. And we've seen instances where, doing them via audio only or phone is more comfortable for certain populations. And depending on the state that you're in, and whether that's allowed, make sure that you're checking into all of those considerations as well. So just, a couple more confidentiality examples from the fields. Some solutions to promote confidentiality include patient use of earphones or providers asking patients yes or no questions. And then consider preemptively agreeing upon a launch to a virtual session, allowing you just to determine whether that environment is okay in the moment, making sure they can see you, they can hear you, and they can see themselves. Do they feel comfortable discussing the appointment topic in their current environment? And that they've proactively prevented interruptions. Maybe there's a sign on the door that says do not disturb. And is there a way that they can let you know if that status changes so that you can, switch to no, yes or no answers, or maybe you need to wrap up the visit and reconnect at another time in order to ensure that privacy. So building accessible telehealth, really kind of, again, digging into some weeds here. And really just thinking about, as you invest in your telemedicine, your telehealth solution within your practice, within your organization, consider using a platform that has capacity to add a third party, whether that be for a language interpreter, for an ASL interpreter, or a remote care provider for a patient with an intellectual disability. Consider reasonably modifying your pre-appointment practices for telehealth to allow for additional time to provide a patient with a visual or intellectual disability extra assistance with using the technology. And then there's some great resources here. Again, you can just click on these links. So there's the new federal guidance there from HHS, which provides guidance on non-discrimination in telehealth. And then we actually partnered, the National Consortium of Telehealth Resource Centers partnered with folks at North Carolina DHHS to build some new resources, specifically tip sheets for telehealth guidance and resources for communicating access for deaf, hard of hearing, and deaf-blind patients. So there's provider versions and there's patient versions, and I would encourage you to check those out if you get a chance. That are really great free resources. So just, we know the definitions, I think, through the Americans with Disabilities Act of disability, and then there are many different definitions for telehealth, but the National Consortium defines telehealth as quite broadly. It's really a collection of means or methods for enhancing healthcare, public health, and health education delivery and support using telecommunications technologies. So what really I want to point out here on this slide is the prevalence of people living with disabilities, and it may not always be evident, and they may not share that. So to plan ahead proactively to accommodate, I think, is really important. So according to the CDC, 1 in 4 adults are living with some type of disability. According to the National Center for Health Statistics, 15% of American adults aged 18 and over report having some trouble hearing. Well, we know this is important, extremely important for consent, for understanding, instructions. And again, this isn't just via telehealth. It's important for any type of healthcare. But making sure you got the tools in the toolbox so that patients are able to hear you effectively. 13% of adult Americans reported having trouble seeing, or that they are blind or unable to see completely. And then adults living with disabilities are more likely to have obesity, diabetes, and heart disease, these chronic health issues that really have an impact on our longevity, quality of life, et cetera. And many of these conditions require ongoing management that can be overseen via telehealth. It's that high touch, right, that is so vital to effectively managing chronic health issues. So some practical recommendations: take inventory. Did your product, services, factors required to provide telehealth services meet basic eligibility requirements for people living with disabilities? Consider compatibility of assistive technology. For example, alternative keyboards. There are keyboards with larger numbers and letters there, or backlight, et cetera, so that they're working effectively for the patients and the provider side as well. We have an aging workforce. Learn about and incorporate accessibility features into practice. So for example, CART, or the communication access real-time translation captioning built into a lot of video conferencing platforms that we're seeing today. Consider important role of the caregiver, a family member, or home health aide during the visit. Let them help you during that visit to make sure that you get all of the information that you need and that the patient effectively hears, understands, and can move forward with the information that you're giving them. Increase your knowledge and awareness related to cultural competency and linguistic sensitivity, and incorporate that into your practice, your telepractice. Really, nothing about us without us, right? I come from a public health background, so contact, survey your patients with disabilities about their accessibility requirements. Don't assume one size fits all, right? And make it truly accessible. Some folks might need to hear from you and finish a survey via telephone, whereas others can do it online, whereas others might need a hard copy. So accommodate for that so that you can get the most impactful input on as you design your program. Truly understand that if a person does not have appropriate accommodations, whether they can't hear effectively or understand you effectively, they can't truly participate in an equal conversation, and they can't provide consent to care. Again, whether that's in person or via tele. Allow accommodations requests to be made through user-friendly means. Again, make it accessible. Maybe they can call, do a phone call. Maybe they can fill out a survey, et cetera. Or if they're comfortable with online, they can do that. They can have a friend or family member help them fill it out. Allow patients to provide feedback from the appointment on accessibility. Don't be afraid, to ask those questions and then to address the answers, right? Provide a follow-up survey that really digs into how accessible was the visit and what are the opportunities for improvement. Effective communication. Covered entities, which are, basically all healthcare providers, must ensure that communication with people with disabilities is as effective as communication with others, just like telehealth needs to be as effective in meeting the standard of care as in person. They have to provide auxiliary aids and services to ensure effective communication with folks who have hearing and or vision disabilities. It's never the patient's responsibility to provide their own accommodations. So again, just like in-person care, these are requirements to ensure effective equitable care. And so here we're talking about digital equity. So these are just some examples that I don't, need to read out loud here, but things to consider with respect to being solutions to making sure that all of your patients are receiving equitable care. These are just some snippets from some tip sheets that we created, the National Consortium of Telehealth Resource Centers created, that really kind of get down into the weeds of solutions for tips when treating patients who are deaf or have hearing loss. Again, I don't need to read all of these to you, but sending ahead paper copies or PDF copies for written materials so that they can read it. And then if there's a hearing deficiency, they have it in 2 different modalities, and they're that much more likely to see and understand it and can ask you questions. Ensure they have access to headphones, really to avoid any external noises that can make it harder for them to hear. Using quality microphones, avoid wearing face masks, or if you have to, wear a clear mask, et cetera. How about treating patients who are blind or have vision loss? Be aware of your background. Again, making sure you're not getting washed out. There's contrast. Ensure your lighting is bright enough. Include simplified and enlarged text. Ensuring the patient has a computer screen reading program for transmission of electronic info. And then if possible, you can provide an audio recording of printed information provided during the appointment. And again, there are lots of free and or low cost transcription devices out there now, or solutions that you could use to help you do that. And then treating patients with physical or developmental disabilities. You may need to work directly with the patient in their home if the goal is to provide ongoing care via telemedicine. figure out the lay of the land there, right? Particularly, a home health agency. What is going to make it possible for that patient to receive those services in an effective way within their home setting? Consider consulting with a certified assistive technology professional or rehabilitation engineers to develop tools for the patient. There's lots of great stuff out there. Again, I would encourage you to reach out to your telehealth resource center if you're looking for those types of resources. So these are just key considerations. Hopefully, as you've gone through and you've developed your program, you've identified resources to address each one of these different things, but if not, like just a reminder of the key considerations that you need to be thinking about as you develop your program and test it and get feedback from your stakeholders. Quality improvement, we've talked through a lot of this already. So I would just encourage you to check out, different trainings. We do have through the Northeast Telehealth Resource Center something called Telehealth Classroom, and it's a completely free. You just have to create a free login so we know who is accessing the trainings. But we have a telehealth quality course that walks you through both clinical and operational perspectives. We have a great video in there that we created with some partners with respect to how do you perform an effective physical exam via telehealth, for example. So I'd encourage folks to check that out. Or there's many other great trainings out there as well. Equity, how can we address it through telehealth? So staff training and awareness, access to affordable broadband and technology, support for patient access and digital literacy, and then really thinking about your program design and your workflow. Do you have interpreter services built in? Do you have adaptive devices and software where needed? Data, and what is it telling you, and where you might need to adjust? And is there anything else that you've received for feedback from your patients that you need to address? After the visit's over, thinking through documentation, things that worked well, things that didn't with the technology, ensuring patient understands where they can get a summary of their visit. Is that a patient portal for your organization? Will it be sent to them? Will it be emailed to them, et cetera? Just like you would do in an in-person visit, what is that workflow for you? How do you get patient feedback? How are you going to ensure that you're receiving that and that it's integrated into your program moving forward? Validated patient experience surveys typically contain questions that address, at a minimum, access, patient-centeredness, overall assessment of the patient experience, and they might also include questions related to patient demographics, social determinants of health, and provider-specific questions so that you can really dig into addressing any challenges that might arise there. So again, we talked about kind of going for that low effort, high impact, making sure that you have these things sort of baked into your program, translations, frequently asked questions, mailers that describe how you prepare for a video visit, the video that I shared with you, marketing, communication, making sure that you're getting the information out to everybody in an effective way and multiple ways, patient feedback surveys, and making sure that they're in the languages that are needed by your patient population. Again, totally vendor neutral, but this is just one example of how a health plan looks at and provides information in multiple ways and places on how people can access their telehealth solution. So on their card, on their website, step-by-step, descriptions, hard copies of things for folks who may not tend to access information via the internet, et cetera. And then wrapping up with just thinking through social determinants of health, or SDOH. We know these, and have been talking about them for quite some time. In order to be able to leverage healthcare services and work and et cetera, we have to first address these social determinants of health. And they include things including availability of resources to meet your daily needs, for example, safe housing, and local food markets, access to healthcare services, both in person and via telehealth. We've started to hear this, digital equity equals health equity, because it truly does. Anybody who wants to access care via telehealth should be able to do that, right? Availability of community-based resources in support of community living and opportunities for recreational and leisure, transportation options, social supports, and language and literacy. So starting with community and patient needs surveys to identify patients who would really benefit from telehealth services, whether they have transportation issues or funding issues, et cetera. Older adults with limited mobility, a lack of insurance, and really improving access to and effectiveness of the value of healthcare services. Chronic care management among special populations can be delivered very effectively via telehealth. Providing remote access to specialists in rural and underserved settings who may otherwise not have access to those services at all, or may have to wait months. And there's the risk of exacerbation of disease, hospitalization, death, et cetera. Providing healthy weight and physical activity counseling via tele. Eligibility and enrollment for Medicaid and other different programs that are so vital to ensuring health and well-being of individuals. Thinking outside the box. And, traditional reimbursement may not always be there, but the value is. And like thinking using tele to link to non-medical services can help providers meet their bottom line with respect to value-based care. So patients can meet with WIC counselors for WIC services while they're at their primary care office without the burden of finding a transportation. Parolees can meet with their probation officer. Parents can meet with their caseworker to increase chances of reunification with their children. And then outreach such as housing assistance, Medicaid sign up, the Affordable Connectivity Plan to access devices and or subsidies on monthly internet bills, health educators, et cetera. So again, thinking outside the box and using the technology more makes everybody more comfortable with it as well. So what's the return on investment? The current shift to alternate payment models led by CMS and others and many state agencies aligns incentives for the provision of social care, reducing challenges with social determinants of health among many populations, particularly from a rural access to care, transportation, et cetera. Increasing primary and specialty care, especially in rural and underserved areas. Increasing social care activities that address health-related social risk factors and needs, increasing the continuity of care, ensuring that people aren't falling through the cracks, or we're leveraging opportunities for connected care among different disciplines and providers, improving inpatient engagement, collaborative partnerships, and commitment to health equity. And then, of course, we know telehealth offers that flexibility and affordability that folks have really gotten excited about over these past couple of years. And value-based care, we've been talking about that for a long time, and telehealth can certainly be an excellent tool in that toolbox. It helps increase healthcare value and affordability. Virtual care technology saves patients time and money. They're not having to take an entire day off of work. We look at island communities in the Northeast and how very difficult it is for them to commit to getting off the island, super remote rural areas for an entire day or more, and the cost that's associated with that from lost work time, daycare, all of the different pieces. Telehealth visits have lower no-show rates. About 20% of Americans live in rural areas without access to specialty services. It can help address that. Improve team-based care, and we know we're in a healthcare workforce shortage crisis, and it can help address some of that as well. I would just encourage folks to get involved in your digital equity efforts. Every state, there's unprecedented resources and funding going to states at this time to address digital equity, because we really, one of the silver linings of the COVID-19 pandemic has really been shining a light on the digital divide and how incredibly important it is for everyone to have access to affordable and adequate connectivity in order to be able to access healthcare, business, job interviews, education, et cetera. So get involved, whether that be within your healthcare organization, within your community. There's a lot of planning going on with funds from the federal government going to states, with respect to BEAD planning, which is the Broadband Equity Access and Deployment Plan. Make sure that your voice is heard. We just submitted recommendations to our broadband action and digital inclusion plan for the state of Maine here with respect to telehealth. So make sure that your voice is heard, again, to be sure that you and your patients are being able to leverage technology in a way that can help everybody succeed. This is just a nice graphic from the Medical Futurist Institute that shows kind of where things are at because technology is moving so quickly, but you can see the green is things that are already available and being utilized. The yellow is in progress, like implantable microchips and bioprinted human tissue, and then still needs time are things like robots and holographic data input. But it's just a nice kind of graphic to see where things are going. But what we've learned, a summary of a decade plus in telehealth technical assistance and training, just like with anything else, if you act like telemedicine works, it will work, right? Look at it positively. It doesn't have to be perfect from the start, but adjust, test, adjust, fix, adjust, and then eventually, you're going to get to a space where it works really, really well. Make sure to acknowledge and appreciate the hard work done by all of your colleagues to optimize the encounter and your patients. Be accessible, be creative. You can use technology, as a tool to help you deliver excellent care. And then learning to roll with the punches. And just to end, most importantly, look at the camera. This is one of our colleagues from the Southwestern TRC, Telehealth Resource Center. Sometimes it really is, as simple as, to connect with your audience, your patient, your group, a colleague, however you're utilizing the technology. Make sure that, you're touching on all of these different things that we talked about here today. But in the simplest of terms, make that connection. And with that, I will say thank you very much for your time and attention.